tell you about the Sudan story that I mentioned earlier. You know, reflecting on the split that they'd caused and that the split that they'd encouraged, and reflecting then upon getting the access to the people. What could they do in that situation? It was too late to then consolidate the clinics into one. They'd already built them. Don't want to remove it from one side, because that would certainly increase the opportunity or the likelihood of violence then towards the remaining clinic. So they thought about what to do. They said, well, we can actually create specialized medical services at each clinic that are necessary for people on both sides here. And one of the key issues they wanted to deal with was maternal health. So they had a prenatal care at one and a postnatal care at the other. And they managed to encourage women to travel across the line, across the boundary of the conflict, to come to the prenatal one, and then encouraging women after children were born to go to the other clinic. Again, a very small thing, very small in creating the connection, but demonstrating that you don't have to be stuck on one side or the other, that in fact you do have a right to access of healthcare in one situation, but that you also can sit with the other people and you can work on that healthcare issue. As Neil made the point that there are these larger goals that people often have, and so vaccination of children is one. Prenatal and postnatal healthcare for mothers and children is another one, where people on different sides can come together on those issues. The fundamental part of the do no harm framework, that minimum amount of information that you need to know in a situation, appears to be what we call dividers and connectors. Dividers are those factors in a situation that cause people to fight with each other, that cause people to be split from one another. Connectors are those factors where people still find common cause and will actually come together. Healthcare is one of the strongest connectors that we've seen. It doesn't usually lead to political change, but it often leads to individual change at the grassroots level, and individual interaction at the grassroots level. Sometimes that moves up the chain into political change. Let me give an example of that. In Somalia, an NGO doing trauma care on rape victims was working with those women, and they began to convene a meeting where they had women from different clans come together to discuss their experiences. In those meetings, those women said, what we experience should not be experienced by anyone else. How do we prevent our men from raping women of other clans? Women in Somalia belong to two clans. They belong to their father's clan and they belong to their husband's clan. They don't marry within their father's clan. They have access and rights to visit both clans. Men do not have the ability to cross clan lines, especially if they're fighting in the same way in Somalia. So they began to go from their husbands' clans back to their father's clans and carried messages back and forth across that, and carried messages of how do we stop the violence, focusing on the violence against women at first, but broadening that out to how do we stop the violence. This was all taking place in Somaliland. And as you know, Somaliland eventually broke out of the process of the civil war in Somalia and became a more peaceful society. That peace began in that trauma care center, as those women were talking to each other and broadened their own experience into the experience of their society and decided to make a change. The NGO was not trying to do that. Outcome that they were not intending. They did hope to gain some sort of personal change in the individuals by bringing them together. They had no expectation that it would lead beyond that. But once it did start to go beyond that, the NGO poured as much time and energy and resources into promoting that as they could. So because they saw that here was an opportunity to go much further than simply treating the individual level. There's a possibility to work on that society. And Somaliland is not the most peaceful place at the moment, but for a while there it was one of the few places on earth where policemen did not carry guns. It was sufficiently safe. It is not as safe anymore. There are other pressures obviously come in, so as we see that conflicts do break out again, but that process began in a health program. And it's where people see those opportunities to create those connections and promote them, that we see so much opportunity for building upon healthcare as one of those common goals that everybody has, and those common values and needs that everyone has, is to make use of that as one of the great connectors among societies. When done poorly, and as I mentioned in the Sudan example, it can reinforce violence. Healthcare can reinforce violence. When done in Afghanistan, of trying to provide health services but not taking account of where they were, can reinforce some of the issues of separation and violence. In Afghanistan, the issue there was ethnic identity. That was one of the key dividers in that district, and they paid attention to that. What they did there was they actually went back to the government and said, we cannot start this healthcare clinic from here, or this healthcare program from this village. We need to headquarter ourselves in a different village. And they had a choice for which village to headquarter. They said, we can expand the health system into that village, but we cannot expand it from that village. And they explained their reasoning, and the government agreed. They explained their reasoning to the villagers in that village, and since they didn't wish to be attacked by their neighbors, they also agreed. And they explained it to the other villages around, that they were doing why they were doing it in the way they were going to do it. So it became a process of not just an outsider coming in at the request of the government and the government's plan doing this, but they began a district-wide conversation about healthcare and how that healthcare could negatively influence the peace in that situation, and then therefore how they could positively influence it. So it became a much larger conversation in that situation.